Welcome, everyone, and happy NP Week. Thank you for joining us today for the webinar. My name is Erica Bloom, and I'm the Product Marketing Manager at Springer Publishing. Today, we are presenting Nurse-Led Transformations, Getting C-Suite Approval for Your Business Case with Dr. Mary Lynn Knighton, an Associate Professor and the DNP Program Director at Azusa Pacific University, and Dr. Katie Waxman, Professor and Director of the DNP Program at the University of San Francisco School of Nursing. Before we get started, I want to mention that this webinar will be recorded. If you miss any portion of the presentation, you can find the video on Springer Publishing's website 5 to 7 days post-event. If you have any questions, please type them in the Q&A box on your Zoom control panel. And now I will hand it over to Mary Lynn and Katie.
Good morning, everyone, and we are so happy to be with you here today, and I think that you will find this webinar useful for getting C-suite approval for your business case on any of your nurse-led transformations. So this is a bit about our bio, which you can read when you get a copy of the slides. But I'm Mary Lynn Knighton, and I am an associate professor and the chair of the or director of the DNP program at Azusa Pacific University. And I, with Katie Waxman, have edited and or authored 2 finance textbooks. Katie, do you want to say a little bit about yourself?
Yes, thank you, Mary Lynn. I'm currently at UCSF School of Nursing, and I'm the director of the DNP program and the co-director for the Leadership Institute. And it's just been really a great experience writing these and editing these 2 textbooks with Mary Lynn. I'll turn it back over to you.
Great. So here are the objectives for today. By the time we're finished, we hope that you will have learned how to, 1, create a business plan for a change initiative, that you'll be able to identify the problem and go through a market and financial analysis and move forward in preparing a presentation for your C-suite. We will talk about how to write an elevator speech and a succinct executive summary document, and then we'll use a case study to illustrate effectively telling your story. So we'll talk a little bit about developing the business acumen that we need to be able to become owners of and creators of and executors of a business plan. So the first thing we'll talk about is a little bit of a historical perspective. Nurse entrepreneurs or intrapreneurs, which we'll hear about more later, have been running businesses for decades. And so historically, a lot of our home healthcare and our nurse staffing agencies were created by nurses. So nurses own and operate businesses that help meet the growing demand for in-home caregiving and temporary or interim staffing. And certainly during the pandemic, we saw a huge need for that temporary and interim staffing. There are independent roles, such as legal nurse consultants and wellness coaches. So nurses can run nonprofit organizations that provide community services, such as art therapy or international healthcare, or any myriad of different sorts of businesses. There are some emerging roles in nursing that include, but aren't limited to by any means, independent nurse navigators, educators, simulation consultants, health coaches, executive coaches. There are nurses who are running clinics, free and charitable clinics. There are folks who are self-publishing books. Others include developing educational courses to help nurses master skills in different areas, such as leadership, legal consulting, case management, even setting up stroke programs. And finally, we have some innovative businesses that include mock regulatory surveyors, personal trainers, bloggers, and cannabis shop owners, and NP-run clinics. So KT is going to talk a little bit about nurse entrepreneurs shortly. Intrapreneurs, who are actually folks that inside of an organization come up with ideas to develop a business plan to improve the quality of care and the profitability of their work setting. So one of the first steps that you need to do is to correctly identify what the problem is in order to be able to help people with your business case. And that can be internally, or that can be from an external consultant standpoint. But you need to clearly identify the problem. Are there layers of problems that and can you address all of the issues? Or does the business plan really need to be focused on a single issue, and then you move on to create an additional plan for other problems? So you need to really clarify that going in and negotiating that up front. You need to ensure that the mission, vision, and values are aligned. So internally, that's generally not an issue, because if you're working for an organization, hopefully those are aligned personally as well as organizationally. But if you're coming in as a business owner and you're consulting, you need to really make sure that your values are aligned with the organization's values, that the mission and vision for what you're trying to do to help them is aligned. And if it isn't, do not move forward. That's a sticky situation to be in if you're trying to fit a square peg into a round hole. I haven't really seen it work out well if those are not aligned. You want to do a feasibility check for each step in the planning of the business case and the execution of the business case. So don't assume that everything is going to go smoothly. Do the check-in. Make sure that what you have intended is actually being conveyed and is being done. Now, you don't have really any responsibility for people implementing things that you recommend if you're an outside consultant coming in, but hopefully they're using your expertise to good value to be able to change something that needs to be changed and improved. So using data to help tell the story is really important. And so getting the organizational data for what the problem is, as well as using benchmarking data for national agencies and benchmarks is helpful as you're building your business case. And then you really want to analyze the potential market implications. Internally, the marketing goes to the folks inside of an organization. But if you're doing something with the community, or what you're doing to help this health system, is to improve community relations and community outcomes, you want to know what those marketing implications are and build that into your business plan. So I'm going to turn it over to KT now to talk with us about building a business case.
Thank you very much, Mary Lynn. So we're going to talk about building a business case, which is a little different than the business plan itself. The business plan is much more lengthy, and I'm going to go over the components of that now. But when you build a business case, it may only be 2 or 3 or 4 pages long, whereas a business plan might be 20, 25 pages. So it's really an agreement, and I think it's the next slide, agreement between 2 individuals to move forward to a common goal. As I said, is a written argument intended to convince a decision maker to approve some kind of action. So you have an idea, you've done your research, and you want the person that you're pitching this to approve of either giving you money, letting you proceed with the project, do some kind of an action. So that's exactly what a business case is. So Mary Lynn mentioned the entrepreneur. Nurses inside the hospital setting or clinic or anywhere within the health system itself that have ideas are really considered intrapreneurs. So they're going to make a difference within the organization. They're not an outside consultant coming in, they're inside the organization. So identifying whether you have a quality improvement opportunity in your unit or in your clinic, then you would lead that process and you would be the intrapreneur. We're going to go over the components of a business plan. We're going to talk about negotiating resources, excuse me, and articulating the value of nursing. This is really what you want to do. Nurses are often undervalued. We need to step forward and build the case that what we do makes a difference, what we do saves money, what we do increases revenue or decrease costs. And so as nurse leaders, and we need to be able to articulate the financial implications and forecast whether we're going to make money, lose money, break even, and that. So we're going to hopefully go over some of those, the business acumen today for you to take back to your organization. So why would you need a business case? Why would you need to develop a business case? When would you need one? There's some examples here on the slide. One is the development of a new service line that you have thought about, talked to different stakeholders about, and you want to propose a new service. It could be development of a program to increase revenue. Increasing revenue is most likely going to occur outside of the acute care hospital walls, because revenue within the hospital are really charges. And we don't necessarily want to increase our charges, and it depends on what our payer mix is and what our write-offs are to really get our net revenue. So I would suggest that if you are thinking about increasing revenue, that this is done outside of the hospital walls, where we have a little bit more opportunity to participate in a program that would increase revenue. Development of a program to operate more efficiently. Many of you have seen processes in the hospital or programs within the hospital or clinics that are just inefficient. So if you have a great idea to help make it run more efficiently, this would be an opportunity to create a business case. And then quality is also a quality improvement, performance improvement program. This is when we can build a business case to maybe increase our educational components that would help enable our infection rates to go down, our length of stay to go down. Something like that would be a program to increase quality. So these are just some examples. So the first thing you want is to sort of summarize what you are asking. It's a written plan, and what we do is we write this up after we've done the whole business case. It's sort of like writing the abstract for an article that you're publishing. You want to write the abstract at the end. The executive summary would be written after you've written your business case. And in a whole entire business plan, it's about 1 to 2 pages maximum, because people will skim over that and then they'll go to the very back of the business plan where you'll have your financial numbers and they want to know what is the bottom line here. But for the business case, we'll just summarize that in a couple of paragraphs as to what we see, what we're asking for, and what the financial implications will be. It would have a concise description of the problem or the opportunity and the solution that you propose with the bottom line financial impact. As Mary Lynn mentioned earlier, we have to describe what the present situation is. So we need to explain what's happening, what the problem is, and summarize those conditions. Ask for what is your need for the request? Why isn't it working right now? Are we out of compliance? Do we have an increased number of falls, infections, whatever the case may be? And then what is the gap? What does the evidence say? What are you doing? What do we need to do to make a difference? And then who are the people that you need to engage with? Who are the stakeholders that need to be a part of this decision? If it has something to do with lab and you don't involve the lab, this is a big red flag. So we need to get all of the players at the table together and identify who those stakeholders are. Some of the stakeholders will only be informed of what's going on, some will be consultants, and some will be active participants. Next, we would describe what is your idea, what is your solution to the problem, and how do you propose to close this gap? Is it in line with the organization's goals and objectives? As Mary Lynn mentioned earlier, it's got to align with the mission, vision, values, goals, and objectives of the organization. And you want to really call that out as indicated in our strategic plan, blah, blah, blah. So you can tie it to that, and then the executives in the C-suite will be able to see that you've really done your homework. Do new regulations impact the program or product? Oftentimes, regulations change with Magnet, Joint Commission, and other bodies that do accreditation and promote regulation. So what we need to do is make sure we're up to speed and compliant. And so if you have an idea to get us to that point, your C-suite will be very able to buy into that, because they do not want to be out of compliance. And is it a safety issue? And is there a compelling reason to bring this idea forward? So one thing you can start with is you have your idea, you have identified the problem, you have your idea, your proposed solution. You can walk through what's called a SWOT analysis. And this is strengths, weaknesses, opportunities, and threats. And this is a format that is usually used for a SWOT, There are little boxes where you can write in these different things. The strengths of your project should be very easily identified. Why is this such a strong idea? But on the other hand, what are the weaknesses that may be called out? Is it financial? Is it people? What are the weaknesses? So that you've really thought this out. These are the strengths, here's the weaknesses. What are the opportunities that are external opportunities are for us to come into compliance, to increase patient satisfaction, staff engagement? And then what are the threats? Have we gone through so much change recently that there's going to be pushback? Are the threats that the hospital down the street is doing the same thing and we need to be first? So really thinking through what the strengths, weaknesses, opportunities, and threats are of your proposed idea. And then we want to think through, and this is what you're going to present to the C-suite. They're going to want to know, what happens if I don't do anything? What if I do nothing at all? What will happen? Will we continue to lose money? Will patients die? Will quality suffer? Will we continue to be out of compliance? So it's nice to build a little bit of a case around what happens if we do nothing? What will continue to happen? And then propose your solution as number 2 and any alternatives that you might have. And then we always like to say, what is your plan B, your backup plan? Because if you propose a solution in number 2 and you say, I need $1 million, and the C-suite says, oh, it's a great idea, but I only have 500,000 to give you. You need to say, okay, well, that's fine. I'll take that 500,000. And here's what I can do with it. Here's how far we can go with it. And that's your backup plan. Because you need to always be prepared. What if they say yes right off the bat? Excellent. So these are the 3 things I like folks to think about, to put in their business case so that it looks like you've really thought this through. And then we need to create an implementation plan. How are you going to put this program or idea into practice? What is your communication plan? Who are you communicating with? How are you going to roll it out? Who needs to be involved, and how involved do they need to be? Do you need any additional resources? Do you need a laptop? Do you need some training time? Do you need a classroom? Do you need to purchase anything in particular? And then who's in charge of this entire plan? Is it going to be you, or is it just your idea and you're working with someone? So thinking through all these components ensures the C-suite that's reading this business case that you've really thought this through. Oftentimes we'll create a Gantt chart, a timeline in order to identify the components of and milestones in which things are going to occur, so that it really looks like you've planned this out. And it's usually could be over a year or more, depending on the project. So this timeline that you're going to create really has to go in line with the organization's current projects and change that's going on. So it is, as a nurse leader, we need to ensure that we can manage change and we are sensitive to all the other ideas and projects that are going on in the organization. So your timeline might be to wait until a certain thing has been launched. If you're launching an EHR or going through a whole implementation on that, this may not be a good time to do what you're wanting to do. Or you may have to bump something that's in progress right now because yours is such a compelling case. So you need a clear timeline, realistic, include those milestones, deliverable dates. What will you achieve at a certain date? Well, maybe we have trained 40 people, and by this date, we're going to train 100 people. And then celebrate that at the end. Once you have done your project and you're able to show success, then celebrate that and put that in your budget, that you need to put in money for a pizza party or an event of some sort. So that's why I always like to put that in the timeline.
Mm-hmm. I think one of the things that it makes me think of is when you talk about a plan B, when that CEO says, here's your money, and they say, I want this implemented tomorrow, you need to be prepared with an answer for what does it take to get it executed. So thanks for
Exactly.
sharing that, Katie.
Yeah, exactly. That's the one that I always think is a holdup. It's like, wow, here's the money. Okay, now what? So this slide is something that really spoke to us in terms of sustaining change. You need to have vision, skills, incentives, resources, and a plan in order to have sustainable change. I talked a little bit about the change process earlier, and I think that there are different levels of change. There's earthquake level change, like moving from one building to another. And then there's subtle change. So being able to scan the environment to identify what's happening and then making sure these components are in place for your particular project to be sustainable. So if there's no vision, and that's through you as the leader, then people can get confused. If the skills aren't developed, then people could have anxiety. If there's no incentives, like what's in it for me, then they may meet with some resistance. And if you don't have the right resources, tools, people, computers, whatever it is, then people will be frustrated. And if you don't have a plan, which writing a business case creates a plan, then people feel like they're on a treadmill and they're like, been there, done that. Why is this any different? Mm-hmm. All right, so then we're going to just sort of go to the next slide, which is really going to talk about the finances. Marilyn, did you want to add something to that?
I did actually, if I can go back.
Sure.
I love this slide, and I highly recommend that you print it out, post it prominently, so that you can refer back to it as you're looking for the vision for your business plan, and for what you want to accomplish with it, because it can actually serve as kind of a checklist reminder that says, what is my vision, and have I articulated it clearly? And what are the skills that are going to be needed along the way? Do I have the skills, or do I need to get other people who have the skills? Are there incentives, and can I afford incentives to do this? And maybe if you can't afford monetary incentives, what are the recognition sorts of incentives? And then just the checklist for all the resources, because I can guarantee you that you will probably forget some of them, but if you start that list, you'll find it, and then your business plan will be much more robust and complete. So I thank you for sharing this with us, KT, because I think it's a wonderful tool.
Excellent. I would just add that, that vision that's so important. Oftentimes when you come together for your project meetings, having that on a whiteboard on the wall to remind people of what we're doing, why we're doing it, so it's not just a treadmill. So keeping that focus is really important. Lastly, and oftentimes nurse leaders will write a business case, and I'm not going to say forget this, but this is the most important piece, really. Quality, patient safety are the utmost. However, we can quantify that. So how are we going to evaluate this program? What data do you need to collect? And this all drives what the financial impact will be. So what are you looking at? Are you looking at length of stay? Are you looking at infection rates? Are you looking at satisfaction? And what are those metrics that you'll use to determine success? What does it look like, and how will you measure it? Those are very important things up front to get some baseline data in which you're going to then evaluate the program. And the next slide really goes into the financial piece. And so, as I said, we need to quantify what we do. So how much is it going to cost? Will it yield a savings or avoid cost? One of the things that we like to focus on is cost avoidance. So we keep, maybe I'll just use sepsis as an example. If we have a lot of septic patients, and maybe we have 50 patients a year that have sepsis, there's a real problem there, right? Is it education? Is it interprofessional education to determine the signs and symptoms of sepsis and avoid them being transferred to the ICU, avoid them getting septic altogether? How do we measure this? Well, how much does it cost if a patient goes septic? They have to be transferred. They have to have lots of medications, there's increased staffing, there's length of stay component. So what does it cost to take care of a patient per day? And so if you're able to decrease those 50 cases to 25, you can show that you've avoided those costs and save lives. But being able to avoid those costs is very quantifiable and would be a pitch that your C-suite would really welcome. And so with that, you have to build a budget. You're going to have to train people, right? You have to train them. And while you're training them, are they being replaced on the unit? Are they here on overtime? Do you need any supplies to do the training? Is it a simulator? Is it a task trainer of some sort? What about your time? Are we going to pay you any differently, or is this part of your own job? And then sort of forecast in what was going to happen in 3 months, 6 months, 9 months, a year, and 2 years later. If we continue with no sepsis, we will avoid millions of dollars in costs each year, save lives, everyone will be happy. And that's what we need to know. When will it make money? When will you see the return on investment? Because you're going to be spending money to do this training. So making assumptions is very important, and identifying what those assumptions are. And then the bottom line is, what is the return on investment? And as I said earlier, this is the last piece of the business case. What is the bottom line? If we do all these things, we're going to avoid costs, or we're going to save money, or we're going to increase revenue. So that's it in a nutshell on the business case. I'll turn it back over to Mary Lynn.
So KT talked with us about the executive summary and the things that you want to include in the executive summary, which is 1 to 2 pages of your entire business case. Now, an elevator speech is a little bit different, and maybe you've heard that. It could also be an elevator pitch. And the idea here is that if you're in the elevator with somebody who is a key stakeholder, you want to be able to tell them your story in 3 minutes or less, so that you can get them interested and perhaps engaged. And so the first thing to do is to introduce yourself if that's needed. So for example, if you're a staff nurse and you have a great new idea about how to improve throughput, trust me, the CEO, the CFO, they all want to hear your pitch. So you might need to introduce yourself if you haven't met them before. You want to describe the problem, but you're not going to describe the entire history of the universe, in terms of what the problem is, but a very succinct 2 or 3 sentences to describe those. Then you want to present your solution. That's like one of the most important things. They're listening to the problem, but they really want to know what your solution is. So again, another 2 or 3 sentences to describe this. And then state your value proposition. As KT pointed out earlier, we want to make sure we're articulating the value of nursing. What can nurses do to solve this problem? And what is our role in the solution to make the situation better? And then finally, you want a call to action. And what that might be is, an ask that says, can I schedule some time with your secretary to go into this in a little bit more detail? Or who would you recommend that I speak with that might be able to help me, or build the solution so that we can increase quality, improve, revenue, decrease costs, save lives, etc. So don't forget to make that call to action, because just telling them what it is doesn't get you any further other than the fact that you met them in the elevator. So I have a cute little story that about me and making an elevator pitch. And so I wanted to share a business idea with the CEO. And so we all would gather once a month for our management, meeting. And I always noticed that he sat in the front row. So, each time I would sit a little closer to the front row. And finally, when I was ready, man, I sidled up next to him, sat down, put my hand on his arm and said, I need a few minutes of your time before you move to the next meeting. And I didn't have to introduce myself. He knew who I was, but I told him the problem. I said, here's the solution that I have. I think that I, with a small team of, whoever was my stakeholders, can make this better. Can I move forward with it? I didn't even ask for an appointment. I just said, can I move forward with this? And so as it turned out, he was very interested in that. And I actually taught that technique to some of my nurse leaders. And I remember him saying, sometime later, I really like that ICU manager. She has really good ideas and she's managing her finances really well. And so, so not only did I get to do what I wanted to do, but in teaching and mentoring other folks to, make their elevator speech and be convincing, he started to notice the folks that were, on that frontline management making things happen. So this could be a very valuable technique to be able to do. And, certainly there are, you can Google different formats to be able to do it, or, again, find references in our books to be able to do it. But it's kind of a fun way to move things forward. And it's, you have to plan it. You got to know what you want to say. You can't just, kind of make it up on the fly. So I suggest that you actually write it down, keep that piece of paper in your pocket. So the next time you're on the elevator with the CEO, you have a captive audience.
And
So
Mary
I
Lynn,
wanted to,
can I just
oh, sure,
chime in here? I think that simulation is a really great modality to practice this. Mary Lynn said, keep it on a piece of paper. If you can get it on a 3x5 card and keep it in your pocket, even better. But being able to just practice it, pretend that you're in an elevator, have someone pretend they're the CEO, step into the elevator, and there you have it. And you can practice so your timing is good and you're not fumbling your words. And then looking around at the folks that are watching you as observers and getting feedback from them to help you make it even better. And the more you practice it, the more prepared you'll be.
I love that idea. Simulation can help a lot of things for sure. And it makes it safe, that way when you get feedback, you're getting feedback from folks who aren't going to, judge you in terms of approving your proposal or not. So great idea. So on this slide, I want to share a story. And this is how to use storytelling effectively. So in honor of this being Nurse Practitioner Week, I want to share this story about how to build a business case for a palliative care nurse practitioner role. And just for those of you who are joining us from other states, please recognize that California is a state that does not yet have full practice authority. And there was less practice authority when I proposed this business case. So this occurred in a 385-bed level 2 trauma center hospital that was in the poorest service planning area of Los Angeles County. And this represents a resource scarce environment. So essentially, nurses screened patients for palliative care needs on admission, daily, and as needed if there was a changing condition. And it resulted in dozens of patients on the list daily who needed a palliative care consult. We also had patients who had extensive lengths of stay in the ICU getting expensive and invasive treatments when really they needed a quality of life treatment plan. So we had 2 part-time palliative care board certified physicians on staff, one of whom retired, which was almost crisis inducing. And what happened was that most patients were not seen by the palliative care physician, and many of the attending physicians weren't able or willing to order palliative care interventions. So I had a little grant money left over from another project, which is about $50,000. So not very much, certainly not the 500,000 or the million that Katie used in her example before. But I thought, I am a resourceful person, so I put that money to use. So I made a pitch and was granted permission to hire a part-time palliative care nurse practitioner for this pilot, knowing full well that when the money ran out, we were going to have to do something different. So we needed to really, demonstrate that it made a difference and have really good metrics. So I created a new role, created standardized procedures or basically protocols for treatment, and the part-time palliative care physician became her supervising physician. So we kept daily and monthly statistics of the increased number of patients that were being seen by this nurse practitioner. We fed these statistics to the board, and the board was very receptive to hearing this. And we were then able to use a comparison of 2 patients. So these 2 patients were admitted to the hospital with an exacerbation of Huntington's chorea. And for those of you who know about Huntington's chorea, there's not a cure for it. It is a neurological condition with psychiatric components, and it's not a pretty condition. And so one of the patients that was admitted, did not receive palliative care interventions because that occurred prior to our pilot. And the patient stayed for a very long time in our med-surg unit and eventually went to our psychiatric unit, but they were there for a very, very long time. The second one was admitted once we had the pilot. So we actually asked the palliative care nurse practitioner to see the patient and to gather the palliative care team, which was the supervising physician, the attending physician, a social worker, et cetera, to be able to customize the treatment plan for this particular patient. What resulted was that there was a 2/3 lower length of stay for that particular patient, which meant that we did not incur excessive costs. We were able to operate with it in our DRG. And the patient actually had a better quality of life and better treatment, because with this type of disease, people are afraid of the patients. And so this was an example that then we had the comparison to be able to share with the board and the C-suite to say, look, this is the monetary difference that we made. This is the quality of care difference that we made, the treatment planning difference that we made. And we were able to then place the patient, afterwards, because the behavior and the neurological, manifestations were managed. So, they were, there was a skilled facility that was willing to take the patient, whereas we couldn't discharge the other patient because of those issues. So what this resulted in was being able to, for money being allocated to hire 2 more palliative care nurse practitioners so that we could have 7-day-a-week, 12-hour shift coverage in order to provide palliative care services. And, and so that's a successful way of looking at this. And so the important pieces of it are that we had a nurse-driven model, so that the nurses did the screening on admission daily and as needed. They met some of these needs on the floor, as just normal part of care, but then they were able to order, basically through the protocol, the palliative care nurse practitioner to see the patient. They would consult with the supervising MD as they needed to. And then eventually we were able to open up home visitation through a larger grant that we were able to get to be able to follow up on the palliative care and supportive care needs of patients in the community. So what started out with an idea and $50,000 resulted in a huge program that reduced length of stay, improved quality of care, did not really bring in any revenue at that point. But, since then, revenue for advanced care planning is possible for inpatient facilities. So, if we did the same thing today, we probably would be able to generate some revenue from some of those charges. So this is a way to use storytelling to effectively get to the yes that you want to get from your C-suite. Katie, any thoughts that you have on storytelling?
Oh, I think that's a great story. I think it's always good to talk about, what was going on pre-project and post-project, so you could show the difference. I love storytelling. Did a great job.
So to summarize, and then we'll move into our question and answer portion of this webinar, clinical acumen plus business acumen, it gives us skills for building a business case. So, as nurses, we have that clinical acumen, kind of down pat. And with a business acumen and business case development, we can certainly add those skills to our toolkit. Never forget to articulate the value of nursing. Nursing and nurse leaders, nurse entrepreneurs, nurse clinicians, etc. Have the skill and the credibility to be able to carry out some of these great ideas that we have to take care of our patients and take care of our communities. Always be ready to pitch your solution to solve the problem. So we've talked about executive summaries and elevator pitches, and practicing ahead of time in a simulation model, as KT has shared with us, is a great way to be ready for that. Make sure you negotiate your resources for that business case and have a plan B. And finally, get to yes with using a compelling story to get folks to buy in to the idea and give you support. So don't forget that ask, what do you want out of this? Any other parting thoughts before we hand it back over to Erica?
Nope.
Okay. Erica,
Great.
you're going to facilitate the questions and answers.
Yep. So now it's open to question and answer, and you can use the Q&A box to ask any questions that you have. Thank you so much for your presentation. You will be all getting a copy of the slides. We'll send that in our follow-up email. And the recording of this will be available within 5 to 7 days on springerpub.com and YouTube. What would you guys, and oh, sorry, here's a question. What's the best advice that you were given when presenting your case? Like what's the best piece of advice you'd give or have gotten?
You want me to go first, Marilyn?
Yeah, go ahead. That would be great, KT.
I would say executive presence, to really use eye contact, look professional, and allow them to ask questions rather than to have you talk all the time, talk straight through. So being able to pause and see if there are any questions.
Invite those questions because you can tell they're thinking of them. But if you are not in a receptive mode or mood, they may not ask the questions if they perceive that there might be resistance or hesitation or just not knowing on your part. So I think one of the best pieces of advice that I got was to determine kind of a format for my executive summary. So in it, KT has shared with us all the components of the business plan, and those are pretty much tried and true. Those work. If you include all those elements, you'll be doing a great job. The feedback that I got was to develop a format for my executive summary. And so I chose to use the SBAR approach. We include that in our nursing schools and to share, with our nurses when you're talking with physicians to talk about situation, background, assessment, and recommendations. And so I use that for my executive summaries because that explains the situation. So we're telling them what the problem is. We tell them about the background. Again, it's not an epic novel, but it is the a succinct way to describe what the background of the problem is and what's been tried before but may not have been successful. And then an analysis or an assessment of the data that you are using to present your solution, and what is your analysis of the problem and the background, and then what are the recommendations. And sometimes I've even put the recommendations first, which isn't really SBAR, it's SBA, because as KT said, they want to go to the end and they want to find out what the solution is. So I've sometimes reversed that, but that has done me well in presenting an executive summary because executives are busy. The board is busy, and so they want to know in a very succinct but informative way what's going on, what the problem is, and what you're proposing. Great question.
Amazing. One more question is, do you have any insight on how to regroup when a business case is turned down?
Well, I'll take this one first, and then KT, you can go second. I think that you need to find out why it was turned down. And so you should ask, is there anything that could have made this better? Is there anything that might have changed your decision to approve this? I've used this with grant funding, where you've put together a great plan, and if it was up to me, I would fund it. But I've had funders say, no, sorry, we don't want, we're not going to do that. And so if you ask them, can you give me some feedback? Most of the time they'll tell you, something that's helpful for you to regroup and represent, or they'll tell you it's not a good fit, in which case you can move on because it may never be a good fit. But it gives you information to decide, do I want to, redo this? Do I want to represent it? And what are the things that were missing that they couldn't see or wanted to see that weren't in there?
Yeah, I would agree. I think that feedback is really important. Loop back with those individuals and say, what could I have done differently? What things are you seeing that maybe I'm missing? And maybe they say, well, why don't you fix X, Y, and Z? That's the hot topic right now. And maybe you missed that. So I would definitely schedule a meeting to debrief and get feedback.
So I see that there's a couple of folks that talked about the regrouping. And so if the timing was wrong, so Elizabeth talks about, presenting a plan that wasn't implemented because it was during COVID and it was bad timing. Well, it was bad timing for most everything, during that pandemic. But, if it's something that is still a valid problem and you have a great solution, then I would, not rewrite it, but take a look at it and see if you can, refresh it a little bit, looking at, the timing now, and represent it. And, of course, include things that maybe you heard today that might make it a little bit more compelling. And then the other question was, do the books cover the CEO's perspective? Well, we actually have a chapter on the CFO and CNO relationship. So KT, do you want to talk about that a little bit? Because I think that's a great chapter to help with the relationship development.
Yeah, the folks from Kersey Bates wrote this chapter for us, and it really talks about evidence related to communication and partnership between the CNO, CNE, and the CFO, and really giving some tips and tools for doing that work early on in your relationship, especially if you're a new leader, making sure that that relationship is fostered very early, and sharing with that individual what actually happens in the unit and on the floor, because they need to see it with their own eyes. And conversely, what are they looking for from a financial perspective, and how can you work together? So it's a really good chapter, and I'd encourage you to read that. Good.
Mm-hmm. Yeah, excellent. I have a scenario, another story around that CFO CNO relationship. So being in a CNO position, and being part of the interview process for CFOs, I always ask the question, how have you in your role educated nurse leaders about budgeting and variances and writing business cases and that sort of thing? And I don't ask them, can you teach us? Because of course they're going to say yes.
Yeah.
But I ask, how have they done that, so that I'll be able to better understand how they'll perform in the future role, based on how they performed in the previous role. And I had one CFO who really, really loved the question. And then when she came on board, we met regularly, and I was doing a total redesign of my nursing leadership infrastructure in order to improve accountability and reduce cost. And so she sat with me, and we marched hand in hand together with that business case, which was actually successfully implemented, and saved over $2 million in just the first 6 months.
Wow.
So, so that relationship piece is really important.
Mm-hmm.
Again, the COO would have a different perspective in terms of operations, the CEO in terms of, vision and, a kind of system perspective. But yeah, make those relationships.
Amazing. Thank you so much. If you're interested in purchasing the author's books, you can go to springerpub.com and enter webinar 23 as a code to get 25% off. Thank you both, Mary Lynn and Katie, for being here today. It was an amazing presentation, and I hope everyone got a lot out of it. Any final remarks?
No, thank you. It was great meeting everyone virtually, and hope you got something out of it and we're able to take something away.
And we do have the contact information for Springer on here. So if you have any questions that, we didn't get to answer today or occur to you after you leave, please feel free to email Springer, and they can get us the questions and we'll get you the answers. But thank you so much for your attention and for making time this morning to be with us.
Thank you.